the next strain pattern is also non-physiologic. It's going to be called an inferior shear. How an inferior shear takes place is you'll get hit in the midline of the frontal bone back towards the bregma, which is over the body of the sphenoid. You're going to get hit right there, and that's going to push the sphenoid. The whole sphenoid is going to be pushed inferiorly or down towards the feet. Now the axes and the planes for both the superior and inferior shear are both the same as it was for flexion extension. So it'll be two transverse or horizontal axes, one for the sphenoid, one for the occiput, and they're going to move in a sagittal plane. All right, let's continue our discussion about an inferior shear. So what causes an inferior shear? When you have a blow on the top of the head, right where bregma is. So bregma, remember, you have your interparietal sutures between the two parietal bones, and you have the frontal parietal suture here. So right here, bregma, right on the top, that's, if you get hit right around there, that's where the body of the sphenoid is going to be. It's going to push the sphenoid inferiorly. So we have our force, and it comes down and it pushes the sphenoid inferior. Remember, it's an inferior shear. We always name everything after the basisphenoid, which is right here. So we're going to move this inferior. It gets pushed inferiorly. Now see how that separates the SBS, and that's why it's a non-physiologic strain pattern. Okay, now during flexion, what's going to happen is it's an inferior shear. So guess what? The basisphenoid is going to move inferiorly during flexion, okay? Still around this transverse axis, right? But inferiorly during flexion. The basi-occiput is going to move superiorly, okay? And that's during flexion. Then during extension, they approximate again. And then during flexion, the basisphenoid moves inferior because it's inferior shear. And the basi-occiput moves superiorly. Still two transverse axes. So we have two transverse axes for an inferior shear. So how are the rotations in an inferior shear of the sphenoid and the occiput? All right, so the basisphenoid is going to move during flexion inferiorly. So flexion, basisphenoid moves inferiorly. As you can see, that's a counterclockwise move. All right, now the basi-occiput is going to move superiorly during flexion. And as you can clearly see, that is also a counterclockwise move. So in an inferior shear, you have two transverse axes, and the sphenoid and occiput move or rotate in the same directions. Okay, we're going to talk about an inferior shear. And what's going to happen is there's going to be trauma that hits you right at the body of the sphenoid. Boom, okay? That makes the sphenoid be inferior to the occiput. So boom, it goes inferior to the occiput. Remember, we always name it after what the basisphenoid does. So inferior shear, it is inferior, and also during flexion, it's going to move inferior. So it's going to be like this, inferior shear, inferior shear. So the basisphenoid during an inferior shear is going to move inferiorly, and the basi-occiput is going to move superiorly. So inferior shear, inferior shear, inferior shear, inferior shear. Now the interesting thing you're going to find, though, your index fingers are going to be moving superiorly. So index fingers are going to move superiorly during an inferior shear pattern. And the reason why that is look at where the greater wings are moving. The greater wings are moving superior. So during flexion, they're moving superior, superior. So this is what it's going to look like. Inferior shear, inferior shear, inferior shear, inferior shear.